being compassionate, providing empathy, working first and foremost on behalf of the patient, the rest of the business takes care of itself. Because the word spreads, and people know the difference between HealthMap and the other competitors that are in the marketplace today. And we do things differently.
Hello, everyone. This is Cole from the American Journal of Healthcare Strategy, joined by a really special guest, a close colleague, a friend of mine we've been working with for a while here, Tom Gaffney of Healthmap Solutions. Tom, please introduce yourself and your role.
Yeah. Hey, Cole. Good to see you, and thanks for the opportunity to connect here. I'm Tom Gaffney. I'm the Chief Growth Officer for Healthmap Solutions. I joined HealthMap back in 2017 as a board advisor, and then spent working with Joe Vadamadam, the founder, for a couple of years. And then in 2019, we were able to get some funding from Winrose, as you know, and they asked if I would, take a full-time role as a Chief Growth Officer, which I was very happy to do so. So I've been working with HealthMap since the summer of 2019. I have responsibility for sales, account management, and marketing, and just really excited about all of the great things that are happening with HealthMap right now.
Really appreciate you coming on and being willing to talk about this topic as well. I know a lot of firms, they like to keep their kind of secret sauce secret, but you're kind of willing to come on and share a little bit, which I really appreciate, because when HealthMaps first brought their product to market in 2016, things looked very, very different than they do today. And I think that's both politically, but also culturally and also economically. Things are drastically different almost 10 years down the road. However, HealthMaps have been very consistent over these 10 years. And in fact, from what we've talked about, they're providing more and more value to their customers as time goes along, as a lot of firms are struggling to do this. What does that look like when you're speaking with your customers? What does the value proposition look like between 2016 and where we are now?
Yeah, that's a great question, and you know what? You're allowing me to reflect on where we've been at HealthMap for the last 5 years or so as I've been a part of the company. But it's interesting. You say even with all the market changes that have been occurring, changes in the financials and changes in how delivery will be provided to our members, the influence of AI, and all of this other great technology that's being brought to market. We have been pretty, true to what we initially designed as a company and as a program back in 2013, and then bringing our first customer to market in 2016. So as I'm thinking now, Cole, based on that question, we continue to have the same clinical and operational model, obviously with some enhancements, but we still have the key themes of what was important to us when Joe Vadamadam started the company in 2013, which was create a program that could be a population health structured model, which, in 2013, we were the first kidney population health management company to the marketplace. And we continue to be very much focused on population health. And it's been what's made us so successful. Additionally, we were very focused on moving upstream in the disease state progression, and making sure that we had the opportunity to work with members early in the process. Obviously, for any success of any chronic disease program or any disease in general, the earlier you can identify that the patient is diagnosed, the better opportunity there is for outcomes. So we very much were focused and continue to be focused, almost 9 years after the fact, in making sure that we're moving upstream to be able to work with the members earlier in the CKD progression, which frankly is CKD stage 3. And by doing that, by focusing on CKD stage 3, it really allows us to have the biggest impact on the overall success of the kidney program. Because whereas historically most vendors were focused on the ESRD patients, because that was the immediate pain point for health plans and other customers, everyone knows that if you're truly going to slow the progression of the disease, and it's sometimes try to avoid, the only way you're going to do that is to get with the patient early on in the process, because with those stage 3 and stage 4s, you can really make an impact. But when you start to look at CKD stage 5 and ESRD, by that time, the patients are already too far down the path, and they're really focused now on making sure that their end stage is being managed effectively and they're compliant with it. But you can never regress the process of the disease state with kidney disease. So, we have stayed true to that, and we think the biggest difference in Healthmap compared to our competitors is that we are the experts in the earlier stages. That doesn't mean that we're not managing well the stage 4s, 5s, and ESRDs, but we do know that we have something that's unique and important to our customers.
Yeah, and being that focused on the actual kind of ROI of each stage, I think is really important, right? Because we've seen this with a lot of firms as AI has come out. There's this temptation in the marketing and in the messaging to shift away from what, Health Maps has maybe originally done. You guys could rebrand and call yourself an AI firm, but you haven't really done that, right? I've talked to Eric about AI and the use of AI. You guys are very much on the bleeding edge of technology, but you're remaining laser focused on, especially those, like you said, those earlier stages and trying to manage it correctly. I have to ask, has there ever been a temptation from a growth perspective to, add some AI terms or buzzwords into your messaging and marketing for your clients, and why have you decided not to go heavy down that route?
Yeah, I think a couple things, Cole, and absolutely, we're using AI today. If you look at our technology platform, which is proprietary, it's called Compass. We do leverage and utilize predictive analytics and AI to effectively manage the patient needs, within our organization. But at the same time, we also know that technology is important, but so is the hands-on, face-to-face interaction that we need to do with the patients and with providers. What's interesting, and maybe for a different topic, is you may be aware that we just announced an acquisition of a new company, Carium. They are a digital technology platform that does amazing work, and we're excited about the opportunity to utilize that technology and continue to grow our technology footprint, and doing that through AI. So more to come on that, but we are very much focused on using AI where AI is important, but there's a lot of other things that need to occur and need to happen for success, and those are the things that we're frankly focused on today.
That's an excellent answer. I appreciate that a lot. So it's people first, patients first, providers, all of your clients who you're working with are the number one thing.
Yeah.
And then the predictive analytics, giving them the best tools they can, is really coming in short second place. I think that's awesome. I think that's a really good way of looking at things. And that kind of lends to my next question. You're talking about how you partner with all these individuals. Really, it's not just health plans, but it's health systems, providers, ACOs, and as you kind of mentioned, it's patients you're partnering with. At the end of the day, it's people. Can you give an example of how you've worked? I think of all the different populations, the special circumstances. I also think a lot about the managing of risk. Can you give an example of how you've been able to develop these kind of custom care pathways with your partners?
Yeah, for us, and with all of our customers today, we do utilize a value-based care approach. So when we talk about partnering on pathways, I specifically, in my responsibility, am really focused on how we can manage the pathway of economic success for our clients. So we, in fact, do use, certainly, full risk models. Whereas I think in 2019, when I started working, and with the initiation of the Cures Act and starting to begin to enroll membership, MA membership, in 2021, we were very much focused on, we need to make sure that we have a successful market and model that we can bring to our clients. And in order to do that, we wanted to make sure that we were focused on what it would take to be clinically successful for our clients. And once we had the opportunity to, provide predictable results year over year, understand what it would take for us to scale, as we started to interact with more clients, and ultimately what it would take for us to drive savings and also improve clinical outcomes. In additional to operational and service excellence, we then started to say, okay, we think we've locked it down. We think we've got a really good model, and that's why we're managing approximately about 160,000 kidney members today, is because we're doing a good job with that. We then wanted to now say, okay, what could we do for our clients that will make this, even grab more attention and get them involved with working with Healthmap. And that was really through looking at the economic model that we were bringing. So we started off early on with an ASO based model where we would have a fee and then some gain share. But in 2023, actually 2022, we really started to lean in on it. 2023, we established our model and executed. We started to look at full risk and capitated models with our clients. And the majority of our clients today are asking for capitation. They're asking for downside risk, and we're able to take that for them with them. And the good thing about that, Cole, is that we would never have had those conversations and moved into that economic model unless we knew we could drive success in all other areas of our company and our program. And we were able to do that. So, I think that's been one of the biggest changes for us, and something that's excited us and truly has been a driver of momentum for us when we're working with not just our health plan clients, but those customers in health systems and ACOs that we're speaking with also.
And I love the model. I love the business model in general of that. We're trying to do the same thing at the Journal. We're trying to shift towards value-based marketing where we take that, but it's hard, it's complicated. And so first of all, talking to you and Eric and the team, it's awesome to hear about it because it's it's kind of a dream model, right? Where you're able to really provide this amazing customized value. At the same time though, it's not as simple as somebody purchasing a package, paying for the fee up front and then they get a set service. It's a lot more kind of involved, right? It's involved. And so I guess here's the question of that personally, but also for the podcast. Your services work very well. All of your clients are very happy with them. You're taking on the risk. So there's little risk for somebody to start working with you all. So you could have tons of customers immediately and have this massive growth, but you've been very methodical about how you've been growing the organization and balancing it. How do you do that? How have you figured out what balance to maintain this quality in this interaction with your customers while also, not slowing down on growth?
That's a really good question. And I would say that in retrospect and looking back to, when we first really started to get traction in 2020, bringing on new customers, we wanted to make sure that we were being methodical, as you mentioned, but ensuring that we were also being, we were being slow enough that we were going to be able to take the time to effectively implement our program and ensure that it was delivering on all of the components of the program that our clients would expect, such as, providing savings, driving outcomes, making sure there were strong NPS scores, making sure that, we could go ahead and take risk and make sure that that risk was effectively managed. So I think that was let's go steady and slow, but at the same time, we need to go fast because it was an extremely competitive space, and it still is today. But literally, there were clients looking for vendors, on a regular basis. And there was a market that essentially anybody that needed a kidney vendor could go find a kidney vendor. The challenge was, were you going to find a kidney vendor that was a kidney vendor that was a good kidney vendor, one that could be sustainable and provide ultimately what the customer is looking for, which is not just savings, but overall improvement and enhancements to the clinical model. So we were able to do that. And I think how we did it is we were very strategic and thoughtful about the types of customers we wanted to work with. So, every customer isn't a good customer for Healthmap. So we would, in fact, make sure that we were very clear on what types of health plans we were looking to work with. What was the line of business that we wanted to focus on? What was the geographical footprint where we were already managing membership, and it could implement an easy go live for our customers. What else are we able to do as it relates to quality improvement and working very closely with our customers? Or what about looking at starting with ACOs and us trying to bring very much a value-based focus for the ACOs that we're still unsure what that meant for themselves in what the future would look like. Was it going to be an MSSP model? Was it going to be a reach model? So there was a lot that we needed to be thoughtful about and bring to market that would also allow us to continue I would say, accelerate effectively our pipeline, where we could go ahead and continue to bring new customers on every year, with the hope that each year we're going to have the opportunity to implement at least 2 to 3 new customers a year for as long as we think that there's opportunity to manage these kidney population.
And there's tremendous need out there, right? I was just doing, I mean, I'm sure you've seen the research yourself, but I've been doing research on a lot of regional, totally integrated networks, and top expense is usually always kidney, right above everything else by, in some cases, hundreds of millions of dollars in some of these major metropolitan areas. So it's a serious problem, right? And I think the loss is there, but at the other end, what you're saying, the quality problems are there as well, right? A lot of these plans, they're suffering under the burden of the kidney cost, and it makes them reduce their quality and what they can offer their members, and then they start losing stars ratings or whatever else. And so I think that's what we've seen, in talking privately with you and Eric and all of them, times where you guys have come in and it's gone from a failing plan to a plan that's been successful. And I think, like what you're saying, it's because you kind of choose your clients, right? You're not just selling a product. You're really kind of this interesting blend. And I wanted to ask about this too personally. What do you classify Healthmap Solutions as yourself? Because I know it's a vendor of the software that's proprietary, but at the same time, there's consulting, there's this expertise, right? You have Eric and Joe, as CEO and president, who have experience from Magellan, WellCare, Centene. I mean, your executive team is incredible. So you're not offering just a product. I mean, this is really beyond that.
Yeah, yeah. So what's interesting is that all members of our ELT, the executive leadership team, have either worked with a health plan or they've been delivering health plan services through a vendor solution, much like traditional benefit management services. So we've been able to take that experience and expertise, and because we know what it takes to be successful in a managed care environment, and our health system today still is looking and wanting that managed care touch. It's allowed us to go ahead and assess, okay, what's important to the client, the health plan, the health system, the ACO. And because we've been in there and we've been doing these services, before, or we've been making decisions as ELT members that were executives at health plans, we really believe that our model is different. Excuse me, especially when we look at the structure of our leadership. Because if you think about our competitive space, most of our competitors came from the duopoly. They came from either DaVita or Fresenius. But we were an independent that really looked and identified that there's an issue in the marketplace. We think we know what the issue is, and we're going to focus on that issue. And by removing and being unattached from any historical, work that had been done in the dialysis space, I think it gave us a very fresh and new approach to look at how we can do things differently. And that's certainly what has driven our model. I think you mentioned a little bit earlier, Cole, about all the things that we've been able to do to create a model that's successful. One of the things that you mentioned, and I just want to reinforce it, is when we're looking at kidney disease and we have a patient that is diagnosed, we're not just looking at the kidney disease. We're looking at all the comorbidities for the patients. Essentially every patient that has chronic kidney disease also has hypertension or diabetes, and in most cases have both of those. So it's important for us as an organization not just to be laser focused on the kidneys, although that's our bread and butter, but for us to provide a very quality model, we've got to be able to look at the whole patient. And, we spend a lot of time managing with those patients on their comorbidities, not just on what we're seeing from a kidney perspective.
I was just reviewing some research on different mortality prediction models for my PhD curriculum, and they brought in a lot of different difficult points. I'm not an expert on this, probably never will be. I'm learning about it slowly. Is this proprietary technology that you have? Is that what allows you to look at that more holistic view? Because I know a lot of the models out there for kidney disease, especially, it's very limiting. It doesn't include usually more than one or two kind of comorbidities in there.
Yeah, absolutely it is. Because when our company started in 2013, even back then, the company was focused on identifying, claims analytics that would help would help providers utilize what we have learned from the data. So it was very much a different focus in 2013 than where we are today, but it was the foundation. It was still that Compass proprietary platform that now we have processed millions and millions and millions of claims through our system. And again, when you look at technology that has machine learning and the opportunity to really go deep and long in what it would look like for us to manage patients' needs, yeah, it's been huge for us, Cole. And I would say it is something that's unique and it's different from what we see with our competitors. Now, take what I've just shared with you with all of that information we have in Compass, and now marry that with what we're going to have with Carium, the company we acquired, from a digital technology AI perspective, and we really have a lot of opportunity to leverage in the marketplace for our providers, our patients, and our customers.
Yeah, that's tremendous,
Yeah.
tremendous, and that's one of the questions I have as well. One of the last questions is the leadership again, the decisions you're making. I love, and it's as an MBA student, I'm really kind of learning from you as business leaders. What is a strategic decision or pivot that, as executive leadership team, you all have come and made that's been really impressive?
Yeah. I've talked about it a lot, but I'd say it again. I think the decision for us to move to a new economic model in 2022, 23 was important for us. Today we're managing probably somewhere between 4 to 5 billion in medical spend, and we're taking risk on that spend. So there's a lot that goes into not just assuming that risk, but being able to manage that risk. So I think first and foremost, Eric Reamer, our CEO, if people know about Eric and his background and history, Eric's a guy that has been around and is expert with capitation and has been doing that for years. So not a surprise to me when Eric joined the company and we were looking at our strategic map, what the future would look like as related to the economic model. But I also think another component of it is in the beginning of 2024, we started to look at our clinical model. Again, although we have the foundational footprint of what we created in 2019 and continue to have as the key pillars of our business, we also know that there needs to be change. There need to be enhancements at times, and those enhancements come in a lot of different ways. Some are technology based, some are personnel based, some are model based. And we did go ahead and start to look at a change to our operational model where we're now using a regional model that allows for our resources that are feet on the street in the local markets, meeting with our customers, meeting with the members and the providers, and allowing us to establish a very strong relationship within that local market. Healthcare is local. So we want to make sure that we're meeting our customers where they want us to meet them. We're meeting with them in the local markets where there are there are economic and political implications in different markets, and we want to make sure that we're there understanding what those implications are and what we can do to help mitigate those challenges, and continue to drive a successful model.
Is an example of that the office in Puerto Rico where you're, because that's one of the things that I try to talk about with people is in-person businesses are complex. Feet on the ground is challenging. It's like whenever I talk to startup founders, I always shy away from in-person businesses personally because it's like, oh my goodness, you have to manage all of this stuff. But that project has been very rewarding. The press was incredible from it. Everyone seems to be talking about it well. Is that an example of that kind of boots on the ground mentality?
Yeah, it is, and I'm impressed that you know that. So yeah, that was a big win for us when we were able to have the opportunity to contract with Triple S, which is Blue Cross Blue Shield of Puerto Rico, and from not having anything but a few guys from the mainland that were building relationships in Puerto Rico, we were able to win the contract. And very quickly, we had to set up a service center, and we had to hire a very strong group of individuals to manage the 20,000 Puerto Ricans that are on the island today. And we did it successfully. We hired somewhere between 70 to 80 employees. We built a facility service center that's out there. I happened to be in Puerto Rico last week speaking with new customer opportunities because of all of the great work that was done in Puerto Rico by our Puerto Rico team, and the success that they've been bringing to the market. It's really if you look at what we had to do in Puerto Rico, it's on steroids by 10 what we have to do in the mainland with other markets. We had to go out and build culture. We had to make sure that we could build trust, and all that stuff does not come easy. And when you look at something like Hawaii or Puerto Rico and the islands that are not quite sure who's coming from the mainland to the island, or these people that we can trust, that's a different dynamic that we needed to get over. And by hiring the right people in the local market, we were able to do that, and we're driving tremendous results today for our customer on the island.
Yeah, that is awesome. I mean, 80 people too. Wow. That must feel really good to be part of doing that. That must be awesome.
Yeah, absolutely. And at the end of the day, we all step back and say, what are we really in this for? And we're in this for, the patients. And, it's funny because I have a woman that is working with me right now, that was a provider relations representative. And when we had closed the business on the Triple S business, she had reached out to me as an employee on our company in the provider arm of the organization, and she had said, from her heart, I just want to thank you on behalf of my family for bringing this program to Puerto Rico, because I have 3 family members that are end-stage renal disease who do not know how they're going to live, without having the support needed. And HealthMap now can help me help my family get better. And she now is a part of my account management team that's working on the island, supporting with account management for our customer there. And it's just a great example. I mean, that's exactly, at the end of the day, what we want to be known for. And if we can be known for being compassionate, providing empathy, working first and foremost on behalf of the patient, the rest of the business takes care of itself, because the word spreads, and people know the difference between HealthMap and the other competitors that are in the marketplace today. And we do things differently. And we like to think the difference we bring is ensuring that we're providing high quality services to our members first and foremost.
As a lot of us in the insurance industry, we're going to be going through our cap season soon in March, April. I'm sure hearing about a vendor where your members would actually be happy about is something new. And I'm sure that it probably excites many people, right? Because as we're going through these interviews with our members, we're hearing a lot of people saying, oh, this vendor isn't working or it's confusing. And then we know as well, especially our dual SNP members, which many of them suffer from CKD, they can't get enough touch points. We don't interact with them enough, right? It's so I think that that's probably going to touch a lot of our audience. And I'll ask one last question. Um, I talked with Eric, 4 or 5 months ago when we first began talking, and he said, big things on the horizon. I asked him what the future plans were. He goes, stay tuned, stay tuned. And so now we've seen the acquisition, we've seen AI progress more and more. Uh, what is the future? Can you share a little bit of maybe like one thing that's going to be coming up with Healthmap Solutions in the future?
Yeah, I think first I would say the future is very bright. And without giving specifics, we're talking about growth on this podcast right now. We're going to experience some very, remarkable growth, in 2025 that we'll be able to bring, new members to our kidney program in 25 and 26. But I can say that you will see some pretty big improvements as it relates to our footprint. Today, we're managing, 43 states in the country. By the end of this year, we'll have all states covered. And I will say that you'll see us, we'll go north of 200,000 kidney members and then some. So I'll leave it at that, but hopefully I can come back and talk to you, 6 months from now and tell you about all the great progress that we've been making.
Absolutely. I'm excited for you to have another 2 billion under management there. Well, we're
Looking
going to
forward
be
to it.
approaching the size of some of these equity firms out there. Right? That's awesome. Good for you.
Great.
That's
Thank
great.
you.
Yeah,
Yeah.
thanks for coming on, Tom. I really appreciate it. I appreciate your advice as well personally, and then for our audience. This is not just advice for people in the CKD space. This is advice for entrepreneurs, business owners, executives, et cetera, because it's a model to follow, really. So thank you again, and yeah, let's meet up again in a couple months and do a check in on what's happened.
Yeah, let me say, Cole, you guys are doing a great job. You in particular are doing a great job. So I'm, I feel honored to be able to, be on this podcast and be able to interact with you. If people want to look at growth, look at where you were, a year ago and look at where you are now. You guys are an organization that is being recognized. And people want to talk to you, and that's a great thing. But it's through the hard work and efforts that you and your team have driven. So congratulations to you also.
Oh, thank you, Tom. You're so kind.